So hello everyone, my name is Suhan, Doctor of Physical Therapy. Do you have pain over this area? If you do, then I have 3 simple ways to manage your pain, so stay tuned. So here are 3 conditions that we want to narrow down to make sure that it is the right condition for you. So first, you experience symptoms right behind the medial malleolus, which is the bony prominent area on the inner side of the ankle. You may experience paresthesia, which means a feeling of tingling, numbness, or pins and needles. The sensation is located over the bottom side of your foot, especially the front side. The second, you have positive outcome during Tinel sign. It is performed by tapping with your fingers over the area that is right behind your medial malleolus. If that triggers paresthesia over the bottom of your foot, then it is a positive sign. Third, you have more aggravation of symptoms during your foot moving up and outward. If you meet all 3 followings, then Tarsal Tunnel Syndrome is indicated. Tarsal tunnel is a narrow passageway in the ankle that is located between the medial malleolus and the calcaneus bone covered by flexor retinaculum. In that tunnel, there are tendons, nerves, and arteries. Tarsal Tunnel Syndrome is diagnosed when the nerve in the tunnel, which is the tibial nerve, is being compressed. There are many reasons that cause compression of the nerves, but we are going to focus on 2 reasons. First, athletes that typically stand, walk, run for a prolonged time, and second, people with having flat feet. So how do you treat this? A conservative approach is recommended initially. Rest, ice, medications can help you to decrease inflammation and swelling. Physical therapy can also be recommended to alleviate your symptoms. So here are 3 recommended physical therapy treatments to manage your symptoms. And first, let's talk about taping. This taping is exclusively for Tarsal Tunnel Syndrome. I'm trying to put pressure off of the tunnel. You need to have 3 tapes, 2 short ones and then 1 long one. The short tapes is about 4 to 5 inches and the long one is about 8 inches. So to begin with the taping, we always want to bring your foot down like this way. And then starts from the taping. The short tape goes over the top side of your shin. So top side of your shin. And then it goes to right above your medial malleolus. And then from here to medial malleolus, there should not be any tension around. And then from the back side of medial malleolus, we want to do little tug, pulling of the skin, and then it goes to your Achilles tendon. Just like that way. And another tape, we want to place it around your top side of your ankle joint. And then it goes to bottom of your medial malleolus, and from that point, we are not doing any pressure, any pulling. And then from the back side, we're gonna do, once you hit the point of your navicular bone, we're gonna turn the direction, and then with a little bit of pulling, and it goes to your Achilles tendon. Just like this way. For your long tape, it goes around your calf. So start from your calf, and then it goes to your medial side of your bottom of your foot. From this region, we want to do just a slight pulling so that it maintains good amounts of arching. Just like this way. Second is calf stretching. I have 2 ways that you can do it. So one way you can do for calf stretching is using a stretching strap. And then we're gonna place this one over the mid position of your foot. And then keep your knees straight. And I want you to pull it backward until you feel stretching over the calf muscles. And then we're gonna hold it for 10 seconds and repeating 10 times. Just like that way. And repeating 10. So second way you can do calf stretching is utilizing a step of stairs. Place your foot over the midpoint of your foot over the stair, just like this way. And then keeping your knees straight. And I want you to push yourself forward until you feel stretching over your calf, and then it is okay if you feel just a little bit over around the knee joint or higher, because that's technically stretching your gastrocnemius muscle, which is one of the calf muscles. When you feel stretching, I want you to hold it for 10, and we're gonna try this one for same repetitions, just like the first calf stretching exercise. It'll be 10 repetitions. Third, tibialis posterior muscle strengthening exercise. So tibialis posterior muscle provides stability of your ankle. It helps to maintain the arch of your foot. So when the muscle is weak, it can lead to pronation of your foot or forming a flat foot. So within lower part of your leg, we have two bones. One is tibia and the other is fibula. Tibialis posterior muscle is originated between those two bones, and then it's moving, inserted all the way down to mid portion of your foot right there. So the muscle is activated when your foot is moving down and rolling inward. So rolling inward should happen from subtalar joints right there. So when you feel rolling in, like that, feeling of your muscle activation over this spot, that's exactly where your tibialis posterior muscle is activated. So here I'll show you how to do strengthening exercise. So bring the band, place them around your feet, and the side that you want to work on should be on the top side, just like that way. And the bottom side of the foot will be slightly upward, just like that way. And I want you to bring your foot all the way down while your foot is moving up. We also want to see the subtalar joint, which is the back side, should be moving up towards ceiling. So moving down and up. Moving this way and up. And you're going to feel the muscle fire over this muscle. We're going to try 3 sets of 10 repetitions. Thank you for watching the video. I hope this helps for managing your pain. Bye-bye.